Dear colleagues, we would like to present our topic and the case report that we call a team approach to digital workflow. We come from Lithuania, and firstly would like to say big thanks to Dr. Sam Amar for inviting us to participate in this event. My name is Rokas.
And I'm Gertrūda, and we are Megagen Knights and work in one team. Here you can see our tired faces after a long day full of work and hard cases, and we always push each other to seek perfection.
Unfortunately, we always remind each other that doesn't matter how hard we try, it will never be enough. But it is much easier to try together. So in our mind, this type of approach, applying multidisciplinary dentistry based on scientific evidence and high clinical qualification with flawlessly structured teams is the key to afford our patients the best results.
Our everyday practice routine is based on synergy of oral surgeon, Rokas Kuprys, prosthodontist, so me, and our dental technician. Usually our work never stops when we close our office door, like Moscow never sleeps. Thanks to digital technologies, we are always connected, no matter in which part of the world we are. Here's the beauty of ArtGate, that we can plan, print, mill, and check everything online despite being out of office.
So why digital? Digital tools are the best way to make teamwork easier. Firstly, we can collect and save all the data in one place. And as Gertrūda told, we have easy access to it from anywhere in the world. Treatment planning, having all the digital information, is much easier. It minimizes chair time. We can have more predictable final outcomes. And what is most important, we can visualize the final result for the patient before we even start the treatment itself. And ArtGate enables us to do everything what we discussed in one platform. So that is much easier and it minimizes errors. ArtGate is a multidisciplinary platform that covers not only implant surgery, prosthodontics, but also endodontics, orthodontics, and orthodontic surgery. Every skilled surgeon is capable to put implants free-handed, and they all will say that. However, guided implantology makes the procedure much easier, faster, and what's most important, with lower complication risk. In our practice, it also works as a marketing tool because we can offer for our patients a flapless procedure with immediate loading. So it really increases our acceptance rate. And it also minimizes the chair time because all the milling and planning is done before surgery. So every process is done before coming to chair, and then the patient comes, we only have to do the surgery.
Digital oral design concept is a helpful tool in aesthetic visualization of patient's problem. So it is not only it helps patients to envision their treatment outcome, but also improves clinicians' diagnosis and treatment planning. It is very important for me. It ensures predictable treatment outcome and increases case acceptance. Also, provisional restorations are altered so that the midlines are straight and coincident to the facial midlines, and the incisal length positioning can follow the lower lip, for example. And here you can see the very nice example of POD.
Okay, so as we're practitioners, I think it's enough of theory, and let's switch to our hard work and our case report.
So we would like to share one of our case with you. This patient came to our clinic complaining of pain and mobility, swollen gums, and pus coming out of tooth number 11.
In the clinic, we have a routine protocol for all the patient. So first, then the patient comes, before we even see the patient, our assistants will always do the CBCT scan and intraoral scan for the patient. That allows us to have all the digital data in one place, and in case we're out of office, we can still check it. So in this case, the CBCT shows bad quality of previous endodontic treatment, tooth number 11, and the periapical abscess. In the mouth, clinically, the tooth was mobile and the gums were swollen. So we decided to extract tooth number 11 and to replace it with immediate implant. Here you can see the planning, the digital planning process done in our team. Every implant that we plan, we always plan in accordance with zero bone loss concepts by Professor Slinkevičius.
All the views in CBCT.
Here we can see the quality of the bone. So that's how the planning goes. And after all the planning, we send all the plans, all the files to the milling center. Then the surgery day came. We already have the implant guide and the provisional tooth. So here you can see the photo after a traumatic extraction, preserving buccal bone. And after extraction, the tooth supported the implant guide is fixed in the mouth. And from occlusal view, you can see that the guide fits perfectly in the mouth. We have double check on two teeth, and all the drilling is done strictly by the protocol for immediate loading. And here's the final photo of the implant placed with correct hex position, ready for temporization.
So we are very lucky to have guidance of safe immediate loading of Megagen. And when the implant is placed, we always measure the ISQ values. So I am sure we can safely load the implant. And after the implant is placed,
after good surgery,
of course, after the surgery, we check again its position according to bone and soft tissue. And zero bone loss concept is our main principle for all implant placement. So finally, temporary crown is screwed on the implant. It leads to stable soft tissue emergence profile and of course preserve buccal bone. And the best award of this part is happy patient's face. So here you can see the last procedure we did. It is CBCT. One more time. Rokas, maybe you can tell some words.
Here we can see the implant in correct position, in correct depth, everything what we planned, we took to the real life. So the guide is accurate, the temporary crown fits perfectly, and we're both happy too.
Yeah, of course.
So it doesn't matter how hard and exhausting the work is. We always joke, smile, and push each other to be and stay positive.
And that is possible only when we love our work and work in one team. So high five, Rokas.
High five, and thank you all. Hope you enjoyed our easy case, but every job should start from the easy ones. So if you want to go digital, always start with the easy work. Thank you.
Thank you.